Yes, hello, I'm Matthias. I come from Germany. I'm 53 years old and I have PPMS myself, and I try to get the HSCT treatment at the university hospital in Mannheim, Germany. But what I was told, also HSCT is the most potent treatment available in the medicine. And it's the last treatment option. It is associated with a very high risk, and only tried if some Ocrevus or something like this stuff is not effective and the patient has a little prospect of a normal life. I was very scared. I was very, very scared. Then one doctor, Dr. Lemke, was told me, hey, buddy, take a look about the HSCT Mexico. I was already scared anyway, and also my wife saying, hey, my wife Sabine, on this part, thank you. You support me so much, thank you so much. And then I say, no, this is, I find out many things in the internet. This must be my biggest chance in the world not to get cured, to stop my progressive MS. And yeah, let me say, I'm immediately jump on, and I come here to HSCT Mexico, and I meet Dr. Terry, and I meet many nice guys here, and I'm so happy. I'm very, very happy. I finished the treatment now, but I must also say, hey, the chemotherapy hits me hard, but I'm so much happy to do this and to finish this. And second day, in 2 days more, I will ready to go back home. And yeah, what is my goal? I'm not a professional YouTube or Facebook. I'm now on Facebook 2 days, and but I find out this is the best way to communicate it. I don't want to get all people coming here to Mexico. What is my goal? I would like to reach, hey, the insurance must pay this treatment, because if you take Ocrevus, for example, this means 140,000, excuse me, means $140,000. This could not be. This treatment here in Mexico means $60,000. This is also a lot of money. But this treatment stops the MS. This treatment gave me a chance to stop my MS from this point. From this point, after tomorrow, I'm coming back home. I will try with the best training to get my walking back. And this is the most important thing in my view, to stop the MS. And I'm very happy to meet Dr. Terry here. And this experience from US and his experience, Terry, thank you that you're here next to me. So it's very important. Please share this to all MS people in all over the world.
And I just want to, say, because I think there's kind of a disconnect between what HSCT is, because that name is a misnomer. That's not truly the treatment. The treatment is 4 rounds of chemo and rituximab. You don't have to do HSCT with that for the treatment to work. The only difference is it would take you 3 months to come out of the neutropenia without the HSCT, which are the stem cells. When they give you the stem cells, it only takes 7 to 10 days. So that is purely done to decrease the amount of time that you're within that neutropenia. But the treatment is to totally erase your immune system and then to restart it with a new immune system. Because we know with MS, we know the cause of it. people say, oh, no, we know the cause is your immune system attacks you. We don't know what triggers that immune system to attack you. They don't know if it's a virus, bacteria, parasite, all three. For some reason, your body attacks the myelin sheath, and then it remembers that myelin, and it creates memory cells, and that's why your body continues to attack yourself. Medications like Ocrevus simply suppress that. They suppress that attack, but it doesn't kill the cells. Okay, so they're still there. So all you're doing is suppressing it, and you're hoping, oh please, that it doesn't attack me again. And unfortunately, over time, people do, but it doesn't actually cure the MS by getting rid of all of the immune cells. So when you do HSCT treatment, which is really chemo and rituximab, you totally get rid of your immune system. We know this because with our blood counts, we go down to 0. And you totally erase those memory B cells. So your body stops attacking, totally, restarts your immune system. And I think people also get mixed up how well it works versus outcomes, because it's going to work. Like, you're going to respond to it. Now, your outcome might be different. It's like 80 to 90% effective. But if you took that number and then broke it down into how healthy you were before you got here, and most importantly, it's what you do when you get done, right? You've stopped it, now your body can heal, but if you go home and sit on the couch, you're not going to get better. So you need to go home, have the right diet, you have to make sure to work out, work your muscles, make sure hormones and thyroid, all of those, you will have a much, that number is going to be way higher, like in the 90s if they, included that. If you have relapsing remitting, you better get here, no questions asked, right? There's information out there that it doesn't work for PPMS secondary. Absolutely it does. The problem is sometimes you have damage to the spinal cord and the body likes to scar. So some of that might not heal, but I will guarantee you what can heal, it'll remyelinate over. Case in point, I have PPMS. Before I got here, I could walk 20 minutes total on the treadmill, 2 degrees up 1 mile an hour. Yesterday I did 1 hour.
No.
And I was on the phone with my wife.
Wow.
And she's crying. Yeah, 1 hour. I mean, it's already. And my friend that came here 4 years ago, Sagara, she came here in a wheelchair and a cane. She's ran 6 marathons since she was here. But she didn't go home and do nothing. She went home. She got neuro PT. She did the So she did all those things to help your body recover. If you're not giving your body the building blocks to recover, it's not going to do it, right? So you have to feed the body so it can heal. The body knows how to heal. You just have to be able to feed it correctly. So, I just want people to remember that HSCT 1000% works. Don't confuse a person's outcome with whether or not it works. It works. This is how you're going to halt it. And then your outcome will depend mainly on, what you do after. Yeah. And HSCT, again, is a misnomer. It's chemo, 4 treatments, and the rituximab. And you would have the same outcome as long as you don't get sick during the neutropenia, because it's going to last 3 months. But they do the HSCT to make that 7 to 10 days. So,
Wow. Thank you for this explaining. Yes, Dr. Terry. I think our goal must be to spread this out to the world, to the MS people.
Absolutely.
So for this, I please all people all around the world. I'm a newcomer at the Facebook. Please help me to share this information. Our goal is to get this knowledge to know to everybody, and to help the people. And Dr. Terry, you would like to also post me your treatment and your recommends?
Oh, absolutely. Yeah. I'll do that. And also people should know that I'm a wound care specialist. That's what I do. I do limb salvage, wound care. So the wounds on the inside are really no different than the outside, other than, we have bacteria on the outside. But even in those situations, your neutrophils or immune system is what causes the inflammation and causes wounds not to heal. And I know with the wounds on the outside that I treat, once I get rid of all of that bioburden, which is going to be bacteria and then their immune cells, once I get rid of that inflammation, just like the immune cells on your spinal cord that we get rid of, once you get rid of that, then your body can actually heal. It just can't heal when it's full of those neutrophils and all the different immune cells that are causing the constant inflammation. So this totally gets rid of. Now your body's like, okay, let's heal. I know what to do. And so then you feed your body. You give it the best nutrients, the best supplements. You make sure that your body knows to grow, that you're working out, and you will have, excellent results.
I have a wish. Can my Dr. Lemke can call you, and you can explain?
Yeah, I'm gonna get all the blood work that you should have done, everything that you should have optimized, and the type of supplements, and then also the diet you should follow and the workout.
Okay, and this will be published at the YouTube channel. Also on my Facebook, and maybe you can share this audio on your Facebook.
Yeah, I mean, I'll send it to you, and absolutely.
Yeah, and then you can have all free information. Please do this. Oh, I see. Hey, Danny, there. Oh, this now my caregivers come, and I would like to explain a little bit more about the caregivers here. Me decides not to take my lovely wife Sabine to come with me to support me. We decide to take a caregiver here, and I would like to get my caregiver. And please, on the HSCT Mexico, you have also written what is a caregiver done here. But I would like to introduce my caregivers here because I was amazing time with him, and he helps me to develop a YouTube channel, to develop a Facebook channel, and I would like to thank you. Thank you. Danny, come to me. Hey. Hey.
Hello.
Hello.
Well, my name is Daniel Mora, and I am part of the clinic. I do the job as a caretaker, and this month has been a big pleasure for me to be part of Matthias' journey, and also learning a lot of him, and also helping him with all this big desire to share HSCT in all over the world. Because the only thing he's looking forward is to help people, to have a chance or to have a different options, more options to fight against MS. It has been my pleasure.
Thank you, guys.
And I just want to say, when I first got here, I had my mom here for 2 weeks, and then I had my wife here for a week. I will tell you that basically my mom and I got lucky because we kind of stole a caregiver because they make it so much easier. Like we just use his name's Sebastian. That was with someone else, and we would just follow them around because they take care of everything. Because you don't know Spanish, you don't know the lingo. Like when you go places, they take care of things. And if you're wondering, I'm not sure about having a stranger in my room. They are very private. They have you have 2 bedrooms. Literally, they stay in their bedroom if, however you want it done, like they're really out of your way. So it's not like somebody's just sitting there staring at you all the time. They're very professional. I have a caregiver now for the last week, and he's awesome. Like he's, and everybody, told me, he would be. And so, I just want to say, definitely, come on in.
Come on here, it's coming. Hey, nice.
So
hello. Yeah, come here, my son.
So, like I said, for the last week, and it's just been a pleasure. It's been great. And if you, are worried about that, do not even hesitate. The caregivers are amazing.
Caregivers are amazing.
Yes, they are.
Yeah. Okay. Thank you so much. Please share, like, and help us by the fight to get the insurance ready to pay for this treatment. This is our major goal. The next comes, the next will follow. This is not the end. This is the beginning. Get?
Thank you. Yeah.